everybody, this is Dr. Joe Borio with this week's Change Your Health, Change Your Life. And I want to share with you a very interesting study, and it's talking about children, so something that's very dear to my heart. I have two boys, Joey, who's 14, and Vito, who's 9, and we're always talking about drugs and you know, the drugs that sometimes you hear about kids using and the DARE program they have at school and how they shouldn't be utilizing drugs, but then we're talking about drugs that are often being taken or being administered often by children for all kinds of problems. And there's a huge incongruency with just say no to drugs when our children are born. The moment they're born, they get nothing but drugs. I mean, the minute they're born, they get vitamin K shot, they get a tetracycline drop in their eye for chlamydia, they get or gonorrhea, they get 30 plus immunizations. Anytime they have a sniffle, they're told to take a pill. If they have a headache, they're told to take a pill. You know, whether it's Tylenol, whether it's ibuprofen, no matter what their problem is. If they have a skin problem, a breathing problem, an infection, they're told to take a drug. If they're having trouble learning, they have drugs now. If they're too hyper, if they're too sad, if there's anything going on, there's a drug for it. And many times their kids are being told, or parents are being told, to take a drug for their child, or to give their child a drug, and they don't even know what it's going to do. Well, at least try it. How's he doing? I mean, it's really kind of scary. So this study I wanted to talk about, it's called The Drugging of America's Youth. And it's babies on cocaine is what it was talking about. And it was a study really evaluating Ritalin. And they used one drug, but it really goes into all different types of drugs, and it really starts to bring into question whether or not these drugs are necessary, what other types of choices do we have, why are these children sick in the first place, why are these children having problems, are they having problems? I mean, that's the other question. You start talking about Ritalin, you know, we're looking at kids with ADD and ADHD. You got to understand, many times they're the smartest kids in the class. They're the geniuses. They're the kids that their brain processes data and information, and they can process it and spit it out faster than the average. Yet we're dumbing these kids down so that they can sit in a classroom, as opposed to recognizing the fact that their brains are beautiful and they have something different and unique going on, and that require a different setting to learn, but it doesn't by any means require them to be doped and drugged for them to sit in a classroom with everybody else. So anyways, in this study, they were talking about under federal law, Ritalin is classified as a Schedule II controlled substance, the same classification given to cocaine, to morphine, or opium. In addition, Ritalin has now been shown to cause a long list of side effects, including depression, fatigue, paranoia, irritability, bedwetting, cancer, suicide, mental retardation, as well as all kinds of stomach problems, skin problems, liver problems, and so forth. So the drug actually causes receptor changes within the brain, but the drug doesn't just go to your brain when you swallow it. It goes all over your body. So now your whole body has to deal with that drug. Well, some children did not show outward side effects. There's still long-term damage. And now we're really starting to understand that Ritalin has many more long-term problems than was once thought, because now we're seeing the effects of children taking it for a long period of time. It is now responsible for more street crimes than any other drug, as it has been sold on the streets and being crushed up and snorted or injected into the veins. America is by far Ritalin's greatest user, being used up to, in some school districts, 70% of children in some schools. I mean, that is absolutely disgusting. It is incomprehensible that now we have 70% of our children have ADD and ADHD. No, what we're doing is we're setting up a school system that is, and not to get too deep in the school system, but we're setting up a school system to institutionalize our children, that we want them to walk in like robots, sit down, I'm going to teach a class, no one's allowed to move, no one's allowed to utter a word, that's what they're supposed to do, I'm done with class, they move into the next class. I got to tell you something, that isn't how the human body learns. The human body and brain process data through movement, through kinesthetic movement, through listening, through hearing, or through visual, through touching things. And not only that, we're seeing now through science that the brain actually learns and hardwires the data if it's learning while it's in motion, while the body's in motion. So the idea that children are supposed to sit still and watch a presentation or sit still and listen, that is exactly the wrong way that children learn. So what we're doing is we're setting up this system. Children don't fit, rather than looking at the system and questioning and going, geez, here's all the children, 70+% aren't learning that way. I got an idea. Rather than change the system, we're just going to dope up the kids so that they can what? So the kids can sit there in a classroom under drug, dope them up, dumb them down. And then now we're seeing these kids with all kinds of paranoia and depression. We're seeing children doing suicide. We're seeing children killing their parents and killing grandparents and going off. All these kids are on drugs. All these kids are on some kind of medication. You know, we got to start looking at it, America. We got to start waking up and saying, holy mackerel, I mean, we're losing it. We're losing it. We're trying to make everything fit. We're not following rules. We're the principles and laws of nature. We're not looking at children going, you know what? Children are meant to jump around and bounce around. Let's set up schools so that they can learn in the environment in which they're meant to learn, as opposed to sitting in some class that they were never meant to learn exactly that way. And then because they're not fitting, we're going to dope them up. It's disgusting. It really is disgusting. So, we talk about these DARE programs in school. We tell the kids to say no to drugs, and yet everything they do from the minute they're born is nothing but drugs. It's so incongruent for a child now at 13 or 14 years old when you're saying say no to drugs. Well, Mom, every time I had anything, you're giving me a drug, but you're telling me this is a bad drug? You know, you're swallowing down Valium and Xanax and who the hell knows what. You're having a drink. You're puffing on a cigarette. You're doing all kinds of things to your body. You're saying no to me? You know, that's incongruent. We're not living by an example in which we want to leave our children. You know, there's a great video or a cassette. It's dating myself here, but a cassette that I listened to, and it was called Yes or No. And it was how to make the best decisions. And one of the examples they used where they were using tribal decision-making, tribal wisdom. And they used American Indians, they talked about the Aborigines in Australia and different groups, Hunzas in Asia. And they said when they looked at these groups and they had to make a decision, the political group, if you will, the wise men and women of the group, would, before they ever made a decision, they would have to decide, does the decision fit for us now? Would our great-grandchildren be proud of the decision we made? And would our grandfathers and our great-grandfathers be proud of our decision that we made? So it wasn't just that quick decision now. Is this the right decision now? That wasn't the only test to determine whether or not that decision was of value. It was, geez, would our great-grandfather be happy, and would our great-grandchildren be happy? So it really starts to look at the full spectrum of that decision. It really starts to look at the ramifications and the consequences of those decisions, good or bad. And if it didn't meet that test, then the wise group would not approve that decision. They would let things be as they may until they came up with a better decision. Tell you, we could use a lot of that wisdom right now when it comes to the health of our children. Folks, the children of today, our children right now, are not expected to live as long as their parents. I mean, what else needs to happen before we have to stop and take a look and say, wow, this place that we're going, the direction that we're going, is the wrong direction. And rather than waiting till full crisis, rather than waiting till a full breakdown in every aspect of our society when it comes to the health and productivity and well-being, social, physical, mental well-being of our people, of our tribe, of our country, Rather than waiting for a full breakdown, why can't we see everything now as it is and say, wow, we need to make some changes? That's what we need to do. We need to make those changes. Because this has got to become unacceptable. And when it becomes unacceptable, people are willing to take action. I hope that you're hearing some of that. You know, when we look at, in closing here, there's so many things to do and what might affect the overall health of our body. And there's laws and principles, you know, not rules, laws and principles. A rule is like the speed limit, you know, it's 55 miles an hour. You can go past 55. You with me on that? So that's a rule. A law means, listen, you put junk in your body, it's going to get sick. I don't care. It's a slow poison. It may not be cyanide, but it's arsenic. It's going to kill you. It may take a few months. It may take a couple of years. It may take 2 or 3 decades, but it's going to kill you. And we got to start looking at that. We got to start understanding that the stressful environment that we've created for ourselves is killing us. We have to look at the fact that we're not sleeping regularly. We have to look at the fact that we're constantly living in a state of anxiety and anxiousness and fear. And those thoughts in our brain make us sicker. And science is showing that in every aspect, in every experiment. Our thoughts affect our DNA. Our thoughts affect our present status of health. Our thoughts affect our longevity. We have to start looking at our nervous system. And we got to make sure that we get our spine in good alignment with adjustments to make sure the messages that my brain is trying to send my body to allow it to work as well as it's supposed to, and my body's trying to send it back up to the brain, that all those messages are getting there. The body's working just the way it's supposed to. Those are laws. They're not rules. You can't violate the law, because when you violate, or at least attempt to violate the law, you lose. You will always lose. And folks, we're losing because we're violating those laws. We're violating those principles. And we have to step back and say, how was it meant to be? We have to step back and say, this is how the body was meant to function. This is what the body needs. This is the environment that suits the body best, rather than saying this is the environment that suits the economy or our crazy lifestyle best, so therefore we got to put a bunch of drugs in our kids and on ourselves as adults so that we can better cope with society, which is only making us sicker. I mean, folks, you got to understand something. Our healthcare system not only is in crisis, it's going to bankrupt us. And nobody seems to be paying attention to it. And it's pretty scary. Guys, not to be bleak, but I'll tell you, and I always try to end it on a positive note, though this will be tough today. I want you to take some action. I want you to look at the environment that you're living in. I want you to look at the environment that your children are living in. And I want you to ask yourself that question. Is this the best environment for them? And if it isn't, make some small steps. Start today to make some small steps to make it better. And it may take a couple of months, it may take a couple of years, but I can guarantee you this: nothing will change if you don't make any changes. Nothing will change. And if you make even some changes, it still makes a benefit, and it'll help hopefully influence other people. Guys, it's been Dr. Joe Borio. Remember to eat well, exercise, think good thoughts, drink a lot of good water, and remember, you, your mother, your father, your grandfather, your uncle, your cousin, your co-workers, everyone you know, you got to get them on a regular chiropractic care. Keep those nervous systems healthy. Keep the brain messages, the signals going up and down the spine, making you a healthier you. This has been Dr. Joe with Change Your Health, Change Your Life. I'll talk to you guys next week.